Think of all the times you have been prescribed an antibiotic. According to the National Library of Medicine, the first antibiotic was discovered in 1928. However, the webpage posted on Britannica by Douglas Moyer claims potential for antibiotic resistance was already noticed in the early 1940s. Infection caused by antibiotic-resistant organisms are the reason for thousands of American deaths each year. The overuse and repeated exposure to medicines and excessive use in agriculture have created this uprise in our country. The lasting effects include illness, death, and the bad reputation given to healthcare facilities for the spread of the bacteria. By learning about the causes and effects of antibiotic-resistant organisms, patients will understand the threats brought to them by menacing bacteria. The CDC says antimicrobial resistance happens when germs like bacteria and fungi develop the ability to defeat drugs designed to kill them. That means the germs are not killed and continue to grow. A few of this bacteria are commonly known as C. diff, MRSA, VRE, and CRE. These germs are more robust than the regular bacteria that surround us, such as bifidobacterial and lactic acid bacteria. The Science magazine states MRSA is a major cause of difficult to treat infections, particularly in hospitals, with MRSA also being the second most cause of death by drug-resistant bacteria. The National Library of Medicine explains that the CDC has put bacteria into different categories and how they present urgent and serious threats. Many of these bacteria, however, have already been put clinical and financial burdens on the U.S. healthcare system, families, and patients. For example, a statistic from the CDC says that in the results from a study in 2017, there were estimated to be 119,247 MRSA infections, with 19,832 deaths associated with the diagnosis. For these people, the average length of a hospital stay is 10 days. The average hospital cost is $14,000, making the length of stay and the cost 2 times higher than other reasons for hospital stays. So, compared to non-threatening bacteria, microbiologists and infectious disease specialists advise avoiding antibiotic use if at all possible. The National Library of Medicine also says they suggest to healthcare professionals that they hold off on prescribing new antibiotics and use less of old ones to fight non-serious infections. They claim that this practice will lead to the reduction of new antibiotics and diminish the return on investment. The National Library of Medicine reveals the main cause of this resistance includes inappropriate prescribing. Other causes that are considered are the use of antibiotics in agriculture, overuse, and regulatory barriers set up by organizations such as the FDA. The issue this problem presents affects patients in numerous ways. Many patients are afraid to stay in the hospital for this reason because they are afraid it is dirty and unsanitary. An article in the Journal of Hospital Infection written by the Healthcare Infection Society, government officials admit, we have found no primary evidence for linkage between hospital cleanliness and MRSA incidents in publicly available data. However, it is reasonable for patients to have this fear because, as previously mentioned, bacterium has caused thousands of patients to die and family members to lose their loved ones. The National Library of Medicine supports this statement with evidence of a national survey conducted by the IDSA, Emerging Infections Network, that more than 60% of recipients had seen a pan-resistant, untreatable bacterial infection within the prior year. They also mentioned that MRSA has killed more Americans than HIV and AIDS, Parkinson's disease, emphysema, and homicide combined. In conclusion, the infection of antibiotic-resistant bacteria is the cause of thousands of deaths of Americans each year. The repeated exposure to these drugs is the cause of this issue our nation faces, and the effects of it are seen in our healthcare system. It threatens the lives of patients all over. Since antibiotics are prescribed so often, patients need to reach out to their healthcare provider to become more informed on this topic.